Welcome to What Does It Mean to Be Pre-Health? Here in pre-professional health careers over the years, we've been asked a lot of times, how can I be sure I'm making the right choices? Am I doing everything I'm supposed to be doing? Should it be this? Should it be that? And I wish we could offer that kind of certainty, that sort of clarity, like there's a recipe or formula that's guaranteed to work every time, but it's far better to take the approach of thinking about it systematically, developing an approach that is strategic and intentional, but more about you becoming the best version of yourself than any one thing that you might do along the way. So during this presentation, we're going to cover what we often talk about at our Red Raider orientation sessions during our welcome session about what it means to be pre-health. Our experience has been that there's a lot of students who want to become healthcare professionals, but the goal is to eventually turn the corner and start working for it, and then turn once more toward working intentionally and strategically based on the best decisions for you. And so as we go through this presentation, I encourage you to think about it from that perspective, that we're going to be offering you a framework, a way of thinking about being pre-health as opposed to some specific list of requirements. Now, we work with students every semester who have demonstrated their capacity to be successful here at Texas Tech University, but sometimes their end results are not what we would consider successful results. And what I mean by they demonstrate their capacity to be successful is that they've been admitted to Texas Tech University. Our Office of Admissions wouldn't admit a student if they didn't feel it was in their best interest, if they didn't feel like that student could be successful here at Texas Tech. But as we all know, there are students who are admitted to institutions everywhere who don't have successful results every time. And instead of just throwing up our hands and wondering why that is, we actually did the research. We ask questions of students when it doesn't work out, like, did something change? Did their goals change? Because every once in a while, students start out pre-health and they decide they want to do something different. But if a student isn't successful, it's usually not that. Was admissions wrong then? Well, I've been on campus for a long time, and our advisors have a ton of advising experience, and that is almost never the case. Usually, it's not the environment that changes either. Certainly, there's lots of ups and downs, in college campuses these days, changes in policy and practice and organization and stuff, but it's usually not these things. It's not the goals or the evaluation of the student that was wrong. It's not how the institution wildly changed, but usually it's a pattern of behaviors that don't align with their goals. See, perfection is never the standard for pre-health students. What we're often looking at is the majority of the time, not every time, not 100%, just more often than not. And if a student is successful, more often than not, their behaviors align with their goals. But if a student isn't successful, the same could be true. It's not one mistake here or there, one thing they should have done or shouldn't have done. Usually, it's a pattern of behaviors that just aren't in alignment with where they want to end up. And so as we thought about how to answer this question, what it means to be pre-health, how to share these perspectives, we start with our 6 statements. And you'll notice down in the right-hand corner that little chemical notation symbol. If you're not familiar with it, that is the benzene ring. That's a hydrocarbon ring, 6 carbon atoms, hydrogen atoms. The way that they share their electrons make that structure exceptionally stable. And our 6 statements that we're going to share with you during this video are also exceptionally stable. They're circular and self-reinforcing. You could ask any of them as a question, and any of the other statements could be answers to that question. Benzene is also a transformative agent in the chemical process. It's often used to turn one thing into another thing. And that's the way we see our 6 statements about what it means to be pre-health. They can also be transformative for pre-health students. But benzene is dangerous. It's carcinogenic. Don't go messing around with it. And these 6 statements can also be dangerously simple. I know oftentimes when I give this presentation, I think students, all they're hearing is some old guy saying, go to bed early, and eat your vegetables. And that's still good advice. But I don't want you to hear it from that perspective. I want you to take it from the perspective of an advisor who's doing everything they can to offer you the best way to think about this challenging process of being pre-health. And our first statement of 6 sometimes might be the most challenging, but we're going to go through all 6 of them. And I want you to be mindful of that. I want you to think about the benzene ring and the way that they are circular and self-reinforcing. Don't think of them as a checklist. Think of them as a total, complete process. That approach, that mindset of working through these 6 statements and keeping them all in mind instead of achieving one at a time is the way that we have built this presentation. So first and foremost, if you want to have a framework of thinking about what it means to be pre-health, anytime you can stop and ask yourself, is what I'm doing right now in alignment with where I want to end up? Are my choices matching with my goals? Am I engaged in the behaviors that are going to help me get to where I want to go? And usually, as I mentioned, if a student isn't successful, it's not because of one mistake or one choice. It's that pattern of behaviors, just things not lining up the way they're supposed to. But I'm going to actually take it out of the college environment to illustrate my point, because I know students will focus on the words behaviors and goals. And what they'll hear is people's voices that maybe they've heard before saying, you got to take this seriously. You got to have your priorities straight. You got to buckle down and really do the work. And that's not the way I want you to hear it. So we're going to take it out of the college environment to illustrate what I mean about behaviors aligning with goals. Let's say the goal is to run a marathon or climb the highest mountain. I don't know, maybe write the next great American novel. All wonderful hypothetical goals that have nothing to do with being pre-health. If most of the time, again, perfection is not the standard. We're not saying all the time. If most of the time, if more often than not, the behaviors are watching Netflix, playing Candy Crush, arguing with people on Reddit until 3 a.m, I promise those aren't examples from my own life. But if that's what we're doing most of the time, if more often than not we're making those choices, we're engaged in those behaviors, then we're not likely to reach those goals because those behaviors don't align. And I'm going to say during this presentation, students, I want you to hear clearly, it is okay to enjoy yourself, to have fun and relax and decompress. So what I'm saying is not all the time you have to be doing the work. I'm just saying most of the time, if you're training, if you're working with someone who has been there and done that before, if you're networking with other like-minded individuals, if more often than not those are your behaviors, then you're more likely to reach your goals. Because being pre-health means first and foremost that you make choices that match with where you want to end up, that the behaviors that you're engaged in align with your overall goals. And for our pre-health students, the goal is pretty clear. When you apply to your professional schools of choice, you want to get a yes. And you might be wondering, how do I get a yes? Well, in our office, we had the same question. And over the last 5-6 years or so, we've really been refining this process and doing the research because we are a learning organization. And we're not just going to leave a question open-ended. We're not going to guess. We're going to find out. So we asked the professional schools at the Texas Tech University Health Sciences Center and others like them from around the state and the country. We reviewed the application profiles of Red Raiders who got in. We looked at what they did to get their yes. We even looked at the professional competency models in the disciplines that our students want to work in. We took in all of that data. We asked for the top 10 list of preferred We asked for the top 10 preferred qualifications of ideal applicants from those professional schools. And as we sorted through all of that information, we looked at trends and patterns and similarities. We were looking for answers to the question, how do I get a yes? And like big nerds, we took all of that in and we made a periodic table of elements. As we were going through the information, we were seeing 2 types of answers. Some of them were numeric, and you might think of them as the measures of being competitive. But others were a little bit more narrative based, a little bit more qualitative, a little bit more about the story of the applicant. So we think of them as the elements of being compelling as an applicant. See, students who get a yes are not just numerically competitive, they're also narratively compelling. And when we asked those professional schools for their top 10 preferred qualifications of an ideal applicant, some of them were really helpful. They were like, we want good grades and good exam scores. We're like, well, thanks, Captain Obvious. Like, we knew that. Everybody knows this. But that's when the shape of the metaphor of the elements really started to come together for us. Because I bet if I pulled up an actual periodic table of chemical elements right now, most of us would recognize the elements at the top of that table too, because they're common, they're abundant, they're critical for life, absolutely. If you don't have them, you're not going to get very far. But we know there's more to life than just the elements at the top of the table. So sure, everybody who applies to professional school is going to be evaluated numerically. They have to take the right classes and earn the right grades. And if those professional schools require an exam, they have to take that test and do well on it as well. But we know that those professional schools evaluate applicants on more than just those two items. So yes, they are critical. That's why they're at the top of the table. But they are common. They're abundant. Everybody will be evaluated that way. But we know that they'll look for more than just that. And so if you ask the professional schools, okay, sure, I have to take the right classes and make the right grades. If I require a test, I'll do that and do well on it. But what else do you want? Sometimes they give very frustratingly vague answers, like be well-rounded. They'll say, have a good resume. I know our medical school colleagues often talk about their holistic admissions process. And what we've come to learn is that the best way to do those things is to get involved on campus, to give back in your community, and especially to engage your profession. Now, my experience has been that most pre-health students are aware of these ideas. These top 5 elements are most commonly understood by pre-health students because, again, they're abundant. They're really, really important. But if a student stops here, that can be one of the most frustrating approaches to applying to professional schools. Because not only did we ask the professional schools for their top 10 preferred qualifications of an ideal applicant, we also asked them what their top 10 frustrations were. And this was one of them. Some students who apply to professional school will take a checklist approach. They'll see these expectations and they'll just start checking off the boxes. Yes, I took the classes and I made the grades. Yes, I took the test and I did well. On campus, I was in a couple different student organizations. I did volunteer work. I did shadowing and observation. I checked the boxes. Oftentimes, there are people who take an impress your way in approach. And instead of just checking the boxes, they try to cram them full of so many things. Sure, those professional schools want to see that you did those things, but they also want to see if doing those things developed in you the actual characteristics and competencies that they're looking for in an applicant. See, just like in the real world of chemistry, the elements at the top of the table are common. They're abundant. They show up all the time in the application process. But the elements at the bottom of the table, they're a lot more rare. They show up less often in application essays, interview question answers, letters of recommendation. But just like in the real world of chemistry, the elements at the bottom of the table, they carry more weight. They might require more time to discover and understand. They may require some caution when handling them. I mean, these aren't checklist items. You can't say to somebody, oh yeah, I have leadership, check. If there's going to be a story there, it's going to be lived out. And so when we're meeting with our students here at Texas Tech University to talk about being the best kind of applicant, to give themselves the best chance of getting a yes when they apply, we're using these elements to organize our conversations, to structure the way that we approach advising pre-health students, and our students are using them to guide them through the process and make sure that these elements are informing their approach, that they're turning in complete applications that are not just numerically competitive, but are also narratively compelling. Because being pre-health means that you're developing the elements of an applicant who's most likely to get a yes. You're working on the elements of a competitive and compelling applicant. And I can't tell you, since we've put this into practice over the last 5 or 6 years, Having these elements makes things so much more clear. Again, it helps guide us through those conversations. It gives structure to all of these pressures and expectations. But some students really quickly realize, dude, that's 15 things. Like, how can I do all of that? As I'm transitioning to college, doing a lot of this stuff for the first time, maybe living with someone that I've never met before, like adjusting so much at that time of life. Is there some way to simplify it? Is there some way to just make it a little bit easier? And I'm glad you're asking those kinds of questions, because we recommend that our pre-health students focus on four specific goals, and you'll recognize them. They are the four of the top 5 elements. They're the things that all pre-health students have in common. See, pre-health students should be working on these 4 goals, because what we know about the elements at the bottom of the table in the real world of chemistry came from what we knew about the elements at the top. If you're doing the things at the top of the table, you're going to give yourself a chance to develop those elements at the bottom of the table. But I don't know what your experience has been with other college students. I've been on campus for a long time, and my experience has been most college students have no specific goals. Anytime you meet somebody new, I encourage you students to ask them, so what are your goals for this semester? Most of them will be like, whoa, calm down. What are you, my parents? Like, I don't know. They'll say things like, I want to have a good semester. They'll say, I want to do well. And those are way too vague to be considered goals. That's more like hopes and dreams. You know the SMART goal acronym: specific, measurable, actionable, realistic, time-based. Most college students have no specific goals. We often hear it voiced in the negative. Students say they don't want to fail. They don't want to mess this up. They don't want to let anybody down. And those aren't goals either. Those are pressures and fears. It is not a surprise for those of us who work on college campuses that students struggle with avoidance and at-risk behaviors, because they arrive on campus with all this pressure and expectation, and they don't know what to do about it. And so instead of just living underneath all of that pressure hanging over their head, they avoid it. Look, pre-health students, if you're going to do more than just survive being pre-health, if you're going to thrive, you have to turn these pressures that you feel into goals that you can work on. You have to wrestle with these things and take them to the ground on your terms. If not, it's going to be tough. And what often happens is when college students arrive on campus, they realize, yeah, this is different than where I was before. They may not be sure if they're doing the right things. So what they'll do is human nature. They'll look around at everyone else and they'll normalize their behavior on their peer group. It happens all the time. When students come to orientation, one of the first things they do is like, I'm not sure where the student union is, but there's a bunch of people walking in that direction. I'll just follow the crowd and I'll probably end up in the right place. But if you follow the crowd in these 4 areas, you may not end up where you think you will. In fact, I'll show you. As it relates to academic performance, most college students are fine. Right? I don't want to give anyone the impression that the only options are that you get into professional school or you're a failure. Right? There's a lot of gray area between those 2 options, and that's where most college students are. Depending on the year in the study, the average undergraduate GPA in the United States is somewhere between a 2.75 and a 3.15. But I'm curious. I wonder what you've heard is a good GPA for professional school. When I ask groups what they've heard about good GPAs, sometimes people whisper 4.0. But in reality, what we know is that most average admissions GPAs, on average, if somebody gets into a professional school, somewhere around a 3.5 or higher on a 4.0 scale. And if you've never done the math on that, a 3.5 on a 4.0 scale works out to more A's than B's. You don't have to be perfect. As I've said, perfection is never the standard for pre-health students. You don't have to have all A's. But I will point out, you don't have to have 100% in a class to make an A either. Unlike most college students, pre-health students need to be deliberate and intentional. They need to set goals for their academic performance. If I could describe what most college students' academic approach is, it's a we'll see approach. They'll say, we'll see how the first test or paper goes. We'll see if I like the class or the professor. We'll see if I get up and go to class. And that passive will see approach usually ends up with a grade closer to a C than is going to work for pre-health students. So we encourage our students to consider academic performance goals, and some of them might be outcomes based. Maybe an overall GPA goal of a 3.5 or higher will work for you. Maybe that will keep you connected and motivated. Maybe you need to go class by class and try to make an A in each class, because if you don't, your B won't hurt you too much. And I know what I said. I said you don't need all A's, and then I just said try to make all A's. But being deliberate, intentional means that maybe we're focused more on the process than the results. I know it sounds dorky, but perfect attendance is a great way to stay connected with your classes. Or maybe it's about putting in the hours per week to get the results you're looking for. If you have no specific academic goal for your next semester, how can you know where you're going to end up? So pre-health students, the first area that they should set a goal should be in their academic performance. They want to know what kind of student you are, and they're going to look at those numbers. They're going to look how you progressed through your coursework. Did you successfully complete what you began, or did you avoid difficult coursework? Set a goal for your academic performance. But they also want to know what kind of person is coming to their campus. And a lot of students report membership in student organizations, but very few actually report leadership. And I know it sounds like you have to do everything, but you don't have to be president of a student organization to get into professional school. I'm just saying you should do more than show up, pay dues, and get a t-shirt. Like, contribute in some way. A lot of students talk about undergraduate research, but less than 25% have done that by the time they graduate. A lot of students say that they're interested in study abroad, but less than 10% have done that or are still working on it. Only about 6% of students nationally are in their honors college. You don't have to do all those things on campus, but when we talk with students in their first fall semester, a lot of them say they haven't done anything at all. And when we ask why not, they say, well, I didn't want to pick the wrong thing. Look, it is better to try something and change your mind than to do nothing because you're not sure where to start. Maybe the goal for your first semester on campus is to try 5 or 6 things and decide which 2 or 3 you're going to keep. Your campus involvement is a chance to show who you are as a person to those professional schools. But so is your community service, right? Your passions, your values, where you come from, and who matters to you. And most college students, even though they know it looks good on resumes, aren't doing community service semester by semester. Sure, some of them might have taken a service learning class, but if community service is required for your grade in a class or so you can be active in a student organization, can you really say it's about you and your passions and values? Heck, we all have opinions about what's going on politically. Most college students are just avoiding the civic process. There's fundraising and philanthropy. There's mentoring, and stuff could be local or international, faith-based, medically based. Oftentimes, students focus on hours of community service, but we've seen that the real challenge is trying things out, deciding which really fits you best. Instead of jumping at things just to get a number, maybe you should consider the story that your community service is telling about you. They want to know who you are as a student, and they want to know what kind of person is coming to their campus. But if I could set a second most important goal for pre-health students, I'd say professional engagement is it. One time I was giving that presentation in a group of people, and a dad at the back was like, well, then make it number 2. Why is it number 4? And if I had said academics number 1, profession number 2, who you are as a person gets pushed out. So instead of doing that, I made a sandwich because I like making sandwiches. But most college students don't have any real lived experience in their chosen professions. That's not going to work in healthcare. Nearly 40% of college students nationally are not going to their career center. Look, I know you've had a student identity for so long. You're whatever mascot at whichever high school, and now you're a Red Raider at Texas Tech, which is awesome. But they do want to know what kind of professional you're becoming. You're working on a professional identity as well. And when we think about professional engagement, students often focus on shadowing or observation hours. But for us, it really seems like the hurdle is finding a couple places to ask. Maybe that's the goal for your first semester. Maybe you should try things out. Some folks are still trying to decide if this is the right profession for them or which one is the right one. Maybe you need to talk with people who you already know who are working in healthcare. Talk about their experiences and learn from them. Do research on your chosen profession. There's books and podcasts and videos, probably not things like Grey's Anatomy, but there's a lot of ways to learn about healthcare. And there's a ton of ways to learn about yourself. You can go to the Career Center, take career assessments, learn about your strengths and how they work in the world of work. You are developing a professional identity. And pre-health students need to be working on these 4 goals to give themselves a chance to develop those elements. But they need to be working on them fall, spring, and summer. Students often say, well, I'm just going to focus on the classroom fall and spring, and I'll do this other stuff in the winter break and over the summer. And suppose you could choose to wait, but other people are choosing to do things now. And those people are going to be applying with you. And I'm pretty sure wherever you're listening to this, whenever you're listening to it, it's fall, spring, or summer. You could be working on these goals right now. And I know it's usually about this point in the presentation where it feels like the air has left the room. It doesn't seem very fun being pre-health. But I want to talk about the relationship between fun and work, because it is work being pre-health. And in my experience, most college students put fun first, which is understandable. It's what we know from TV and movies. And I'm sure most college students have someone in their life who told them a story about all the fun they had in college. And when you're having fun, it is immediately rewarding. I know it seems like a silly thing to say, but I want you to think about it for a second. When you're having fun, you don't have to wait for it to pay off. It's fun right away. It's not uncommon for college students who know they have work to do to set the work aside and go do the fun stuff. They choose to do the fun stuff first. But all choices have trade-offs. If you put fun first, you'll fit right in with everybody else. You'll have that typical college experience, but it can be tough, especially for pre-health students, to get everything done and lead a healthy lifestyle. And as I've shown you, putting fun first, like most college students, doesn't end up with the kind of application that we're looking for. So is that the whole point of this video? Is that pre-health students don't get to have any fun? No, not at all. I'm specifically talking about the order of things. If you put the fun after the work, that still guarantees you a chance to have the fun that you want and that opportunity to develop the kind of application that we're looking for. But if you choose fun last, there'll be a trade-off. It's reasonable to do the work first and put fun last, but that's not what everyone's doing. It's not what they understand college is to be like. No one's going to really know why you're doing it. And you might have to delay gratification a little bit. It's not going to pay off right away. It does pay off, but you might have to say no or not right now, which isn't fun either. But don't think about it as fun last. I recommend that you think about it as paying yourself for the work that you're doing. I mean, think about that. College students do so much work. And when do they get paid? When I give this presentation in a group, sometimes people suggest that they get paid when they get their grades at the end of the semester, or when they get into professional school, or when they graduate with their bachelor's degree. And look, I understand that those are the big picture outcomes. But if I had to wait 16 weeks to 3 to 4 years to get my paycheck, I'd find a different job. And that's just the reality. Most college students realize that fun pays right away. And the work feels like it'll always be there and it never pays off. So they do the fun first. And then they're paying themselves for work they haven't even done yet. They just have things out of order. And that's specifically what I'm talking about, the order of things. I mean, when does work usually happen? I know there's all kinds of jobs, but in the Western world, especially in the United States, the work week is Monday through Friday, 8 to 5. And that's when college classes are. That's when most people were in school before college. That's when professional school usually happens as well. There's no reason to get things out of order just because you're in charge of your schedule. This is the work week, the Monday through Friday, 8 to 5. That's what I'm talking about. And if somebody is enrolled in 15 semester credit hours, which is full load, 12 is full-time, 19 is the max at Texas Tech in the fall and spring semesters. But if you're in 15 semester credit hours, you're going to be in class for 15 to 20 hours a week. But the work week is 40 hours, which means most college students, just Monday through Friday, 8 to 5, have a part-time job of nothing to do. And they don't use that free time particularly well. There's a culture that says avoid early starts, which wastes time in the mornings. And when they're not in class, they say they don't have anything they have to do, which isn't true. There's plenty of stuff they could be working on. So there's wasted time in the middle of the day. This is an example schedule, 16 credit hours with English, chemistry as my science, statistics, creative arts credit, US history. There's my lab. I like symmetry. You might have other priorities that are on your schedule. I'll put in my priorities. There's still a lot of free time in the afternoons during the work week. But what we learned in high school is that we can wait until after dinner or on the weekends and be able to get everything done. But in college, there's so much more to do. And all the fun stuff is happening in the evenings and weekends. And if you spent the whole day not doing work, it's really hard to get your engine started back up and get in gear to do that work. No one's going to ask why you're working on a quiz or reading a chapter, doing drafts on a paper at 10 in the morning, but 7 or 8 o'clock at night. And it's tough. We see students every semester struggling because their late nights are turning into early mornings, and they're in this downward spiral where they're losing sleep and their immune systems and their grades can't keep up with just the order of things. So we recommend that our pre-health students use their workday to get work done. They should start early and finish early, work around class and before dinner. And if they do that, there's a lot more likelihood they're going to have your evenings and weekends free for the stuff that you want to be doing anyway. So much free time. Most college students realize that they have time and they'll say, I'll do it later. And later becomes too late. And you might be wondering, is it even mathematically possible to do all the stuff? Do all the things that I told you to do? So I did the math. You start the week with 168 hours. It's not one of the 4 goals, but I would recommend setting a goal of getting a good night's sleep. College students treat their bodies so poorly, and they wonder why things aren't working. You need to go to bed, and you need to go to class. Now, you won't need an hour for every meal of every day, but college students often fall into this bad habit of skipping meals or eating while they're on the run and not eating well. Good sleep, healthy diet, regular exercise. We're not talking about going to the gym to get swole or get gains, just 30 to 60 minutes of physical activity 5 to 7 days a week. This will keep your body upright. Now, you won't need 6 hours a day, 7 days a week to keep up with all your work in college, but if you did, you could still get involved on campus twice a week for 2 hours, give back in your community once a week for 2 hours, engage your profession once a week for 2 hours. Guess what you have every day? Time. Time to enjoy college, time to have fun. In fact, pre-health students should plan on doing something fun just to enjoy college, something just for themselves every single day. If you are a pre-health student and you're not having fun in college, you're doing it wrong. You should have the time for all of this. But you got to put the work first and then use the fun as your reward. Because if you just keep working and working and working and never pay yourself for it, you're eventually going to switch jobs. Being pre-health means that you have a different order of things. And yes, I know, pre-health students are usually working on more than the average college student. They have 4 goals they're supposed to be working on, and most college students don't have any. They're taking classes that most other college students aren't going to take, and their path to career is different. So many things are different about being pre-health. Most of the prerequisite science and math classes that our students are taking, the other college students aren't. And they are different than the average college class. Most prerequisite science and math classes are on every institution's historically difficult course list, meaning the withdrawal D and F rate are higher than the college average. And sometimes our pre-health students run into their first ever academic difficulty, meaning it wasn't too hard where they were before. It wasn't that big of a challenge, but all of a sudden chemistry is kicking their butt and they freak out a little bit and they start thinking things that just aren't true. They'll think, well, if this is hard, maybe I'm not smart enough to be a healthcare professional, or maybe I'm not smart enough to be at Texas Tech. Look, I've been on campus a long time. In my experience, it almost never comes down to how smart you are. Usually it comes down to the choices you make. If you're smart enough to be admitted to Texas Tech University, you're smart enough to be successful in these classes. The difference will be how you approach it. Maybe for the first time in your life, you'll go to tutoring or supplemental instruction. Maybe you'll go talk to your instructor, your lab TA. Maybe you'll form a study group. Maybe in these prerequisite science and math classes, you'll do things that you don't have to do to be successful in other classes, but that's fine. Because these prerequisite science and math classes aren't just about surviving them. They're about successfully completing them and mastering the coursework. So This is just another way that being pre-health is different. Another way that being pre-health is different is that your path to career isn't like most students. Most people have graduated from high school. They want to go to a great university to get a good job. High school, college, career. That's the path we're on. I know it's not always a straight line, but that's not how it works in healthcare. You're not going to walk off of this campus and become a doctor or nurse. You have to go through another competitive admissions process to go to your professional school to get the license to do the job that you want. It is a different path to career. Some college students don't even have to technically finish a bachelor's degree to enter their job market. But all pre-health students have to move through this two-part education model with the prerequisites in black. Sometimes a bachelor's degree is required, sometimes it's not. And then the professional school in the red. And to pass from the black to the red, everyone has to go through that brass ring of competitive admissions. It's just different being pre-health, right? Not better, not special, different. Different goals, different classes, different path. That's why you do things different from everybody else, which is a lot, I know. And it sounds all great in theory, but people often ask, how's that work for Red Raiders? In the admissions process, what are your acceptance rates? What do I do if I have to wait for my yes? How do I go from the application to the interview to the offer? And that's why you have a pre-health advisor. We're here to help you understand all of this stuff. Generally speaking, Red Raiders outperform state and national average, right? But that doesn't guarantee the next person anything. Every applicant stands on the merits of their own application. And it's better to answer the question, if I had to wait for my yes, what would my plan be, than to avoid that altogether. Healthcare professionals can hold more than one possibility in their minds and plan effectively. But your pre-health advisor is going to be with you for the whole process, not just until you apply. Because ultimately, you're preparing for another competitive admissions process. I say another, but this always gets lost in the process. Texas Tech University is a competitive admissions institution, right? There are people who apply to Texas Tech every semester who don't get a yes. So if you're listening to this as an admitted student at Texas Tech University, congratulations. You've already been successful in one competitive admissions process. And we're going to be on your team for the next one. Working with your PPHC advisor is going to help you do that. Thank you so much for taking the time to listen to this. If you ever have questions, visit our website, give us an email, call us, reach out to your pre-health advisor. We'd be happy to help anytime. Take care.